Let's learn about the human nervous system. There are three main parts of the nervous system, namely the central nervous system, the peripheral nervous system, and the autonomic nervous system. We'll first talk about the central nervous system, which includes the brain and the spinal cord. Our brain is enclosed within the skull. It functions as a central processing unit to control and coordinate thought, emotion, memory, sensation, and movement. The spinal cord extends from medulla to the second lumbar vertebrae. It contains motor and sensory nerve fibers to and from all parts of the body. Sensory fibers carry sensory information from the body to the central nervous system. Meanwhile, motor neurons project their axons into the periphery to innervate skeletal and smooth muscled that mediate voluntary and involuntary reflexes. We'll now move on to peripheral nervous system, which includes cranial nerves and spinal nerves. There are 12 pairs of cranial nerves, which provide sensory innervation, such as vision, hearing, smell, taste, and other senses of our head and face, as well as autonomic motor innervation. There are also 31 pairs of spinal nerves, which carry sensory, motor, and autonomic signal between the spinal cord and the body. Lastly, we'll learn about the autonomic nervous system. The word autonomic refers to how the system regulates our body functions involuntarily. It consists of the sympathetic nervous system and the parasympathetic nervous system, and regulates the functions of internal organs, heart rate, blood pressure, and certain reflex actions. After understanding how the nervous system works, we'll now proceed to learning how to identify the level of consciousness of the victim. We can assess the victim's level of consciousness by using the AVPU scale. A refers to alert and oriented. It means that the victim is alert, responds to the first aider's questions accurately, and oriented to person, place, and time. V stands for responsive to voice. It means that the victim is able to open his or her eyes and try to answer simple questions or obey commands. P refers to responsive to pain. The victim shows no response to instructions and voice, but is able to open his or her eyes with pain stimulus. U stands for unresponsive, which means that the victim shows no response to any stimulus. If the victim is totally unresponsive and unconscious, you can try to find out the cause of unconsciousness, so that the victim can receive appropriate care as soon as possible. There are many causes of unconsciousness, and you may remember them easily with AEIOU tips. Firstly, A stands for alcohol. E refers to epilepsy or exposure, such as heat stroke, hypothermia. I represents insulin, which means diabetic emergency. O refers to overdose or oxygen deficiency. U stands for uremia, which means toxins in blood due to kidney failure. As for TIPS, T stands for trauma such as shock or head injury. I refers to infection. P represents psychosis or poisoning. And S stands for stroke. We'll now move on to learning how to manage unconscious victims. Next, we will talk about how to manage an unconscious victim. First, perform primary survey. DRABCDE. Second, examine the victim by head-to-toe examination, find out the causes of unconsciousness, and provide appropriate treatment according to urgency of the situation. Third, check for other severe injuries and manage the confirmed injuries. If no other severe injuries, Open the airway and check breathing again. If the victim has breathing, place him or her in a recovery position and check the level of consciousness, breathing, and signs of blood circulation every minute, and send the victim to hospital immediately. We'll now move on to learning how to manage unconscious victims.
Management of unconsciousness. Primary survey. D, R, A, B, C, D, E, D. Danger. Ensure the safety of first aider, victim and bystanders. R. Response. Check victim's response. Ask people around to call 999 and take AED. A. Airway. Use head tilt chin lift maneuver to open airway. B. Breathing. Use look, listen, feel method to check breathing within 10 seconds. Carry out CPR immediately if the victim stops breathing. C. Circulation. Check the signs of blood circulation. If there's severe bleeding, manage it immediately. D. Disability. Check the level of consciousness of the victim. E. Exposure. If the victim has other injuries, expose them for further assessment and treatment. Secondary survey. Carry out secondary survey. The procedures include head. Check the scalp and face to see if there's bleeding, swelling, tenderness, deformity or depression of the bone. Check whether the pupils react to light. Check for bleeding, clear fluid or watery blood coming out from either ear. Check for bleeding, clear fluid or watery blood coming from either nostril. Check for any wound, foreign object, loosened tooth or denture in the mouth. Neck. Check to see if there's bleeding, swelling or bruising. Don't move the neck if you suspect the victim has cervical spine fracture. Chest. As for chest, you should check if there's any external injuries. Observe if the chest expands evenly on both sides. Abdomen. For abdomen, check to see if there's any injury, rigidity and tenderness. Observe if there's incontinence. Back. For the back, gently pass your hands on the back and check for bleeding, swelling and tenderness. Extremities. For extremities, check to see if there's wound, deformity and impairment in movement. Check for other severe injuries. If there are other injuries, you should manage them first. Open airway and check breathing. Place victim in recovery position. Check breathing, signs of blood circulation, and level of consciousness every minute.
There are a few things you should pay attention to while waiting for ambulance crew to arrive, such as keeping the victim warm. If the victim is conscious and thirsty, moist his or her lips with water, and no eating or drinking should be allowed. Do not leave the victim alone or unattended, and check if the victim has medical history record or alert tag with him or her. Apart from unconsciousness, we may also come across syncope and should learn how to manage the condition. First, we need to know the definition of syncope. Syncope is a brief loss of responsiveness caused by a temporary reduction of the blood flow to the brain. It usually won't last for more than a few minutes, depending on the triggering factor. A victim who has syncope usually makes a rapid and complete recovery. The most common type is vasovagal syncope, which is known as fainting. It occurs when the victim's vagus nerve is stimulated in a sudden, causing vasodilation and a rapid drop in blood pressure, which then turns to a brief period of unresponsiveness or even coma. A victim who has recurrent situation is usually caused by the same medical problem. Since there are so many causes of syncope and some of them are even life-threatening, for example arrhythmia, heart diseases or drug-induced, victims should be more cautious and seek medical advice as soon as possible. What are the situations that might trigger syncope? Let's play a game to get more ideas. After the game, you may have found out some triggering factors of syncope, such as panic attack, bad news causing emotional distress, pain or unpleasant stimuli, prolonged physical inactivity, such as standing or sitting still for a long time, which causes blood to pool in the lower body, excessive physical exercise, exhaustion, fatigue, hunger, or wearing heavy or tight clothing are also triggering factors. Hot weather, alcohol, or anemia may also increase the risk of syncope. How can we identify if a victim is suffering from syncope? The signs and symptoms of syncope include dizziness, nausea, vomiting, pallor, sweating over the face and hands, weak and slow pulse, tinnitus, confusion, and a brief period of coma in severe cases. After learning the triggering factors, signs and symptoms of syncope, let's take a look at how to manage syncope victims.
Management of syncope. Place the victim in a comfortable position and rest. Remove tight clothing. Encourage deep breathing. Ensure good ventilation. Send the victim to hospital if you're in doubt.
Before the end of this chapter, let me introduce the recovery position mentioned in Chapter 2. We can apply recovery position to victims who are unconscious but with patent airway, breathing, and no evidence of spinal injury. The advantage of using recovery position is that it helps prevent suffocation caused by the fallback of the victim's tongue. The position also makes it easier for vomitus to drain out. How can we move the victim to a recovery position? First, kneel beside the victim. Position the victim's head towards the first aider. Place the arm of the victim that is nearer to you at right angles to his or her body, with the elbow bent and the palm facing upwards. Then bring the arm farther from you across the victim's chest and hold the back of his or her hand against the cheek. After that, bend the far leg just above the knee and keep the foot flat on the ground. Next, support victim's cheek with the hand closer to his or her upper body. Press on his or her knee with the hand closer to the lower body to roll the victim towards you onto his or her side. After that, gently tilt the victim's head back and chin up to open airway. If necessary, adjust the hand under the cheek to keep victim's head leaning backward. Lastly, adjust the upper leg so that both the hip and the knee are bent at right angles to support the victim if necessary. If the victim is found in a lateral or prone position, you should take some of the above steps based on the situation. If the victim is found wearing spectacles, remove them before placing him or her in a recovery position. If the victim has bulky objects in the pockets, remove them before placing him or her in a recovery position. Last but not least, remember that if the victim remains in the recovery position for a long period, nerves and blood vessels of the limbs could be damaged due to the prolonged pressure. Also, if the victim has spinal injury, placing him or her in recovery position may cause further harm. We should be alert of these 2 points all the time.
Open the victim's airway again and try breathing for no more than 10 seconds. Turn his head to the side facing you to keep his airway patent. place his arm nearest to you at a right angle with their palm facing up. Bring his other arm on his chest with palm facing outwards against his cheek. Get hold of the knee further away from you and pull it up. Keep the sole placed on the ground. Support the victim's cheek with one hand, while pulling his leg with the other hand, then roll his body towards you. Position his head to ensure patent airway. Bend his arm and leg at right angle. Then, place your hand on his abdomen to check his breathing. Remember, you should continue monitoring and recording the victim's level of consciousness and breathing rate until he resumes consciousness or the ambulance crew take over.